that we're going to talk about something that's really important in the future. Ladies and gentlemen, esteemed colleagues and friends, good morning. It is an honor to be here with all of you today as we explore a topic of immense significance, the future of global healthcare. I invite you to envision with me a world where healthcare is not a privilege, but a fundamental right. A world where every individual, regardless of where they live, what they earn, has access to quality care. By 2040, we aim to make this vision reality. At GSE 360, we believe in the power of innovation and equity to transform healthcare globally. We are committed to an ambitious mission, creating an integrated healthcare ecosystem that serves 360 million people worldwide by 2040. This is not merely an aspiration, but a roadmap, a collective journey that we can take together to heal our nations and bring about transformative change in global healthcare. Today, I want to outline what this future will look like and discuss the steps that governments, businesses, and charitable organizations and individuals must take to reach our shared vision for healthcare in 2040. So what does that 2040 look like? By 2040, healthcare will be seamless, interconnected system that is predictive, preventive, and inclusive. Leveraging the power of AI, machine learning, healthcare will be personalized to meet the unique needs of every individual. Chronic diseases will be detected early, infections controlled proactively, and underserved communities will have access to the quality care they deserve. See, a healthcare system free from disparities, one that prioritizes health equity and well-being for all, will be our greatest accomplishment. In 2040, technology will have revolutionized care delivery. Virtual care will be commonplace. Diagnostics will happen in the comfort of one's home, and predictive analytics will empower individuals to make informed decisions about their health. We will see healthcare embracing climate resilience, ensuring that even in the face of natural disasters, no one is left without access to life-saving care. However, reaching this future requires bold action today, steps that governments must take. Governments are key players in building a sustainable healthcare system to tackle antimicrobial resistance. Governments need to prioritize funding for research and the development of new antibiotics, strengthen regulatory frameworks for responsible antibiotic use, and investing in surveillance systems will be crucial in containing the spread of resistant pathogens. Just an example. Furthermore, governments must take systematic changes to address health inequities by expanding access to care for underserved populations. This requires a commitment to universal access coverage. You notice I didn't say universal health coverage, because the reality is we have health coverage, but we don't have access. An investment in health infrastructure, particularly in rural and low resource areas. Governments must create environments that foster innovation by supporting research, providing funding for early stage ventures, and incentivizing healthcare solutions that focus on equity and impact. But that's not enough, because the role of business is important. Businesses are at the forefront of healthcare innovation, from climate change and health to digital health solutions. The private sector must work to bridge gaps in healthcare delivery. By investing in AI machine learning powered platforms, businesses can help create personalized health solutions that reach every corner of the world. We need businesses to support, as an example, pandemic preparedness by investing in R&D for vaccines and therapies, building supply chain resilience, and ensuring that health workers are well equipped and well educated. The private sector must also focus on non-communicable diseases by promoting healthy workplaces, supporting wellness initiatives, and providing solutions that make early diagnostics accessible and affordable. Companies like those supported by GSE 360 will continue to lead in developing cutting-edge technology, integrating digital tools that empower patients and making healthcare accessible regardless of the geography. But businesses must also recognize their responsibility in protecting patient data, upholding strict privacy standards, and preventing breaches of sensitive information. That's called trust. You see, in order to have the foundation of this system, this integrated health system, we must have trust. But we cannot do this, again, just between government and businesses. We must have charitable organizations who have long been the backbone of healthcare access for the underserved communities. By focusing on mental health and health inequities, as an example, these organizations can help tackle the systematic barriers that prevent millions from receiving care. It is essential that charitable organizations partner with both governments and businesses and other private entities to build awareness campaigns, education, reduce stigma around mental health, saying it's okay, and make sure that those in need receive timely and accurate and detailed care. They must advocate for food security and nutrition as an example, and promote equitable access to nutritious foods, which is vital for overall health and well-being. But it can't just be the government, it can't just be business, and it can't just be charitable organizations. It actually starts with us. Change starts with us, individuals and communities. We must adapt healthy lifestyle choices to reduce the burden of NCDs. It is crucial that we advocate for our health, that our communities supported health initiatives, participate in wellness programs, and helping to build a culture of prevention rather than cure. Individuals also play a key role in fighting vaccine hesitancy is another example, by seeking reliable information, encouraging loved ones to get vaccinated, and countering misinformation. We must educate ourselves. So this initiative is transformational. Empower communities are a force for change, and each of us can play a part in building the healthcare ecosystem we envision for 2040. The road to 2040 is a collective effort. To achieve this healthcare effort, we're looking to achieve healthcare for 360 million people by 2040. That's a little less than 4% of the global population at that time. And it's not that by any one sector can navigate alone. It's a collective effort, a journey that requires collaboration between governments, business, charitable organizations, but the heart of it is individual. At GSC 360, we're dedicated to catalyzing this change. Our mission is to support ventures that address systematic disparities through innovation. Again, by investing in AI and machine learning powered platforms, we aim to improve access to quality care for underserved population, align financial success with meaningful social impact, and create a future where health equity is not just a goal, but a lived reality. Imagine a world where no one is left behind, a world where healthcare is accessible, equitable, and effective for every single person. This is the world we are building by 2040, and it's up to each of us to contribute, innovate, and lead. So in conclusion, Heal a Nation is not just about medical interventions, it's about healing the very systems that have excluded, underserved, and undervalued so many of our people. By working together across borders, across sectors and communities, we can achieve a 360 transformational effort of healthcare. Let us all be champions of this vision, committed to action today, not tomorrow, not next week, not at the next summit, but today. So that by 2040, every individual, every community, and every nation can thrive with the healthcare they deserve. When you look at the graphics, that's our vision. And so my challenge for you is, what's your vision? What is your vision for healthcare? Not just for you, not just for today, but for the future, for your children, to your families. When I was a young officer in the military, I worked for sent to do a fellowship, a civilian company, and their motto was, "The future is now." And when I asked the chairman and CEO of the company, what did that mean and how did he come up with it? He said, I've taught, my culture here is that every decision that we make today must have an eye on the future. And this company is one of the few companies that is left in existence in their domain. Because all of the folks that were their competitors, you have to now go to the museum and see them. Because he had a vision for the future. And so in conclusion, look at the graphics. What's your vision? What's your future? Because through a digital integrated platform, that's what we're investing in, and that's what we're going to build. Thank you for your time. Thank you for your vision. And I solicit any of your questions that you may have. Thank you. Any questions?
No,
Yeah.
that's a quick question. So 2040 years ago seemed far away. It's actually only 16 years from now. So when I break that out, if I was thinking of this in a business perspective, in a quarterly perspective, you're literally 4 years away from the first quarter of your vision, moving towards your vision. So we understand what 2040 could look like, but what do you think are what are the key, goalposts or the first mile marker, even 4 years from now to get from where we are today to where you want to be in 2040?
So That's a great question because you're right. So in order to create this system, you have to break it down in pieces of bytes and quarters, right? Because there's a business aspect to that. And so where we see is our first step is investing in that technology that actually is going to integrate that system, right? So we actually already have a system that's in place being developed in Boston at the alpha stage that integrates everything so that in the palm of your hand, your health history, your health record is there. And through this integrated system, we plug in all of the companies that you've actually heard from. All the types of companies you've heard from since you've been at this summit will come into this system. And into this system, they will then draw into what? A 360 million individual system as we grow. So business actually will hit milestones as they plug in. Because we just heard previously that someone has an app that has all of their data over 3 or 4 apps. We're talking about having it in one place. And it's predictive and analytics, and then it's informative. And so how businesses will be able to plug in, because one of the biggest challenges for business is what? Traction. Right? Well, when you plug into this integrated system, you're going to get traction because we're creating team of teams and networks of networks. And as you come into the network, you're now going to have access. And that's those founders then will be able to say, here's how I can meet it. And you also heard from CEOs of providers. And so I asked a CEO of a major provider, what could you do with this system? I didn't hear from him for 6 months, and I ran into him in another event similar to this. He says, I have not forgotten what you asked me. I went to my department chairs and I asked them that same question, and we were working on it. Because here's what the future is, my opinion. The governments are going to turn off the tap. And when the governments turn off the tap, private industry is going to have to fill the void. And so this is a great opportunity that's coming, right? So we can empower ourselves by making an impact and then having viable economic returns based on the fact that we're gaining traction and we're solving a need. Because ultimately what we want to do is increase access where access needs to be increased. We want to increase quality where quality needs to be increased. And we want to maintain or reduce cost. This is what that integrated system will do.